Okay. Welcome to the meeting of the Health and Wellbeing Overview and Scrutiny Committee meeting today held online. This is our first meeting online, so this will be, hopefully will work out okay. First of all, we'll deal with apologies for absence. Chris, can you tell us if we have any apologies for absence?
Karen?
Everyone's here, Chair.
Thank you. Okay, minutes of the meeting. Oh, sorry, we'll do a check-in. I think, Chris, you'll do a check-in to see that everybody's up and running. Will you go ahead with that, please?
Yeah, Karen, do you want to do a name check or anything?
Will do. So, members, I'll call your name. You can just confirm that you're present. Councillor Armstrong.
Present.
Councillor Bowman.
Present.
Councillor Sesford.
Present.
Councillor Dungworth.
Present.
Councillor Hutchinson.
Present.
Councillor Nisbet.
Present.
Councillor Patterson.
Present.
Councillor Rickaby.
Present.
Councillor Simpson.
Present.
Councillor Watson.
Present.
Cabinet Member Councillor Jones.
Present.
And we also have the Business Chair, Richard Dodd, present here today as well.
Okay, thank you very much, Karen. First item on the agenda then is the minutes of the meeting held on the 3rd of March, which were distributed to us some time ago. I've looked at them, they seem all right to me. One of the things obviously is that some of the updates, for example, the Berwick Hospital update that we had, I would imagine that that's all kind of delayed because of coronavirus. But apart from that, that would be the only comment that I would make. Does anyone like to make any comments for either accuracy or comments on the content of the minutes? If you would like to do, raise your hand, please, and let us know. What's going on there? I can see Claire wants to speak. There was an awful background noise there. Try again, Claire.
Hi, Jeff. It was just an update on Berwick. It's that plans are moving forward and plans are being submitted. So we've finished the engagement with the local population, so it should be okay.
Good. Good to hear it. Thank you very much. Any other comments on the meeting from anyone on that meeting? I can take that as okay then. Thank you very much. Disclosure of members' interest. I will go through this. This is the opportunity that you all always have to declare any members' interest which you have not already declared on the forms held by the County Council. If you have anything you'd like to declare, please say so now. I see nothing from anyone, so take that as nothing to declare. We'll move on to item number 4, which is the forward plan of key decisions. And I'll ask Chris to take us through that, please.
Yeah, the forward plan is just a note at the moment.
Okay.
Excuse me,
So
excuse me, Chair. We've just had somebody join by telephone whose number ends in 94. Could I just ask them to confirm who it is on the call, please?
Hi, it's Pamela Phelps from Northumberland CCG. The video call's not working, so I've joined via telephone.
That's absolutely fine. Thank you for that.
Okay. So the forward plan, going back to that again, you've got it, you've seen it. Chris has got nothing he wants to say about it. Has anybody else got anything they'd like to say? Susan?
Hi, sorry. Just say that one, I think obviously it's a moving feast at the moment, and I suspect that there'll be stuff that were on today's agenda that's going to go into the future as well. And I'm not sure that the end of life working group will be ready to report in September because that's been delayed. So I said might need to be pushed back. We're starting with meetings remotely now, but we've had 2 months of nothing. So
that's very, very good point, I think, Chris. I'm sure this plan we'll need to update after today anyway.
Yeah,
But also, Susan's point is well made, so we can perhaps reschedule that report coming back to this committee.
yeah, the forward.
Chair, it's Kath. It might be useful for us to get an appropriate time frame in relation to that. So let's do it. We'll get some out of this meeting. We'll get a catch up as to where we're at with that, and then we'll chair an appropriate time frame rather than just putting it back in, because it might be that we can't actually get the work done by September either. So we need to gather the information to determine when would be an appropriate time to come back.
Okay, now how would we decide on that?
I can
We're
have
not
some
sure when we can
conversations
restart.
I can have some conversations out of here to do a catch up as to where we are. Susan and I can maybe have a catch up, and anybody else who's involved in that group, just so we're clear. I'll talk to Chris first, and then we'll get an appropriate time frame.
Okay, that's fine with me. Everybody else happy with that? With forward plan? Okay. Right. The reports for consideration by this committee. The Health and Wellbeing Work Programme as Appendix B.
Yeah, again, like the forward plan, it's just to know it is obviously under the current circumstances, it will change. And we need to have a discussion about what the work programme is going to look like going forward.
Yeah, I think that's a fair comment, Chris. Anybody else? Okay, leave that as well then. So, the next meeting is scheduled for the 7th of July. I don't know. I don't think it'd be any reason to change that at the moment. But if we have anything urgently, we could do. But at the moment, it's looking like the 7th of July. Presumably, that will be another video link one. But now we're going into urgent business, and we have the COVID-19 update and appendix to discuss first. So who is it that's going to talk about that for us?
So is this the response to the care? Which piece are you doing first, Jack? It's in two separate sections.
Yeah.
the other thing
Well, we've got
might be useful if we can put the report up as a presentation as well, because I'm struggling to look at, I have no means of printing anything out, so I have to only look at things on the screen, and it's quite hard to do. So whichever ones we're doing, it would be useful to have the document there for us to be able to look at as well, please.
I don't know
Sarah, are you able to do that?
Yeah, can you do that, Michelle?
I could, if somebody can confirm to me which document it is.
Michelle, I don't think you will have
Right.
that because that was sent as urgent business last night.
Right.
But I do have it, so I should be able to share it now.
Yeah, that's super, Karen.
Before we do that, can I first of all explain? I'm like most councillors, I'm against getting lots of information, lots of reading shortly before a meeting. But I have to say that in this particular case, we had absolutely no choice in the matter. Some of the stuff was produced as late as Thursday and Friday of last week. And when we come on to some confidential stuff, that was also meant to be kept right till the end. So I apologize that you've had only really this morning to look at these things, but it was circumstances beyond our control. We really couldn't do anything about it. Liz, is it you that's going to take us through the update of the COVID-19?
Yes, I am. Councillor Jones, is there anything you want to say before I launch into it? Are you on mute?
You're on mute, Veronica.
Put me on mute. Right, am I back?
Yes, you are.
Yes,
I
you are,
took it off
Veronica. Yeah.
mute. Somebody's put me back on. So I think it's I think what I was saying was that the track and trace is really quite technical. So it's Liz will know far more about this. I mean, I can read it and I follow what we're doing, but I think the nitty gritty has to be down to Liz. I think it's the particular interest is the one that's hopefully we're going to get the information back from a wider range. Currently, we're only getting information back from the hospitals, and the new biosecurity centre hopefully will be able to give it us with postcodes, which means we'll be able to identify hotspots. I think again we're going to do more on communication, and that's a communications engagement board that I'll be chairing, and I think that we need to get that over as well, so people know exactly what they can and can't do. I think that's it really. I'm going to let Liz take you through the document. Thank you.
Okay, so I probably could have written a thesis on this particular subject, but I have restricted it to testing, the test and trace, NHS test and trace, and the development of the council's outbreak control plan. I think, you know, this continues to be a rapidly evolving situation. There's a lot of uncertainty. There's a lot we don't know. The science is continually emerging, and you know, that is subject to interpretation, because you know, any science that does emerge, there is you know, generally more than one view about how that should be interpreted. So I'll start just by looking at some of the statistics, and if any of you were looking at the Northumberland Gazette or any of the local papers yesterday, they were reporting a significant spike in cases in Northumberland. So on Saturday, the national tracker was reporting 938 cases, and by Sunday that had increased to 1,006. So that's an additional 72 cases. And bearing in mind that we've only had 938 cases since the beginning of the pandemic, that is a staggering increase. I can say with almost complete confidence that that is a data anomaly. I spoke to Public Health England on Sunday, and they think that there has been a data dump from the laboratories for testing from April and May. We don't know whether those are actually new cases that we aren't already aware of, or whether they're duplicates. But they are interrogating that data to find out what the issue is. In terms of the sort of the spread of disease amongst our population, you know, it looks pretty similar to what it looks like nationally. There is a difference in terms of women and men, and in terms of sort of regional variation. Anybody who saw that sort of regional take on the R0 value will have seen that the Northeast has the highest regional rate of positive cases and the sort of highest R0 value. And you know, that may reflect a genuine increase in the proportion of cases, or it may reflect better testing. And the difference in this R0 value may actually reflect the sort of different timescale for the epidemic in the north, because we were lagging behind some other areas. So lots of things to take into consideration when interpreting the data. In terms of the proportion of the population that we think has been affected, the ONS are doing regular surveys in the community, and for the last couple, it looks as though about 1 in 400 people are positive at any one time. and looking at some of the data on antibody testing, which is looking at people who've had the infection, about 1 in 15 people have been infected. But that does differ between populations. So if you did that antibody test in healthcare workers and social care workers, the proportion who test positive would probably be higher. In terms of the figures, I'll have to put my hands up and say that there is an error in the figures in paragraph 6. So actually, as of the 29th of May, it was actually 286 deaths that have been registered in Northumberland, and that's 29% of the total deaths from all causes registered in the same period. For us, the death registrations peaked on the week starting the 20th of April, and during that week, about 45 people, the deaths of 45 people were registered in Northumberland. They're not all Northumberland residents, but most of them will be, and that's compared to 13 from COVID-19 last week. So the deaths have dropped off, which is really good news. Although, you know, clearly all of those 13 deaths are tragic events, and we want to see that drop to 0. So just looking at the testing, I think, you know, the testing has been quite confusing. There are multiple ways of getting tested, but the national strategy really talks about these different pillars of testing. And, you know, in basic terms, pillar 1 is all of the tests which are done through the NHS. So this is largely healthcare workers, care home residents, and or symptomatic care home residents, and individuals who've been admitted to hospital. And then the pillar 2 is all of the other testing. So that's the mobile testing units, the regional testing unit, which was at Gateshead IKEA and is now at the Park and Ride at Newcastle Great Park, and all of the testing which is done through the various government portals. We do have, we're unusual actually in having a regional testing strategy group, and that group has been really important in terms of developing some guidance on how we want testing to operate across the region and how we interpret the tests, because we do need to be quite careful about how we interpret those tests, particularly individuals who are symptomatic and then test negative and are working with high risk or vulnerable patients. You know, we want to take a really precautionary approach to how we manage those individuals. I'm sure you'll be aware of some of the issues around the mobile testing sites. So we don't really have, well, in fact, we don't have any control over when they come. We've had a little bit of control over where they decided to place themselves in the country. And on average, we have a mobile testing unit in Northumberland about every other day. There are some pilots being run in North Yorkshire and Gloucestershire to look at how local authorities can have more control over where those testing units do their testing. But of course, in order to point the testing units in the right direction, you actually need to have the information. And at the moment, we are getting no more data other than the data which is on the national COVID-19 tracker. And really, that data is of very limited value because it is only the NHS data, and it doesn't include any of the pillar 2 testing information. So in order for us to, you know, fulfil our responsibilities as a local authority in you know, planning and managing this this pandemic at a local level, it's absolutely critical that we get that information. There are a whole load of issues with testing, and I won't go through those because you know, I've written them in the report, but I think as a region, we'd really like to turn the testing around so that it is driven by evidence and science rather than driven by you know, a desire to achieve a set number of tests. I think it's fair to say that all of the issues that we've had with testing, we have you know, raised through numerous routes. I think, you know, they are being acknowledged in various areas and are being worked through. But the whole issue with testing is absolutely quite critical to us being able to manage the pandemic appropriately. So moving on to contact tracing then, this was set up last Thursday. You know, contact tracing is again absolutely, you know, a critical component to managing any infectious disease incident or outbreak. And it is a national contact tracing process. So locally, our local health protection team, which is part of Public Health England and based in Newcastle, they will be dealing with all of the complex cases and high consequence incidental cases which fall out of NHS test and trace. So, and basically they'll just be doing, well, they will be doing what they would normally do to manage an infectious disease incident and just ensure that all of those public health interventions have been put in place. We've got a really good working relationship with Public Health England. You know, I think our links with them work incredibly well. I think the implications for us as a council, though, are, you know, it's absolutely critical that we ensure that the secure workplace guidance is put in place, because failing to maintain social distancing does put people at risk of having to isolate for 14 days if they're deemed to be a contact of a case. Clearly, I think there have been some real concerns raised about the impact on fire and rescue, and I think fire and rescue have received some specific advice now about how that can be mitigated in that setting. There are a number of areas where we will need to take a multi-agency and quite coordinated response, and I'll go on to talk about that when we talk about the outbreak control plan. But I think it's fair to say that you know, NHS test and trace is, you know, it continues to be a bit of a quite a bit of a work in progress. And I think one of the critical areas for us is to get that data flow going so that we can get a much better understanding about what the infection looks like in a local authority setting, you know, and how it varies across the county, because that information is really limited at the moment. In terms of the outbreak control plan, we have no role in the contact tracing process routinely, other than dealing with the consequences of any incidents or cases that are come to our attention through Public Health England. But there is a national group which are supporting or which is supporting councils to develop their outbreak control plans. So we've got quite a bit of guidance from that group about what needs to be in there, and I've articulated what the expectation is on page 7 in paragraph 20, and they've identified 11 beacon local authorities who will share best practice, and Newcastle is one of them. and the intention is that actually Newcastle will actually be a north of Tyne beacon, so it will be Newcastle, Northumberland, and North Tyneside. And I think, you know, as a principle, we need to identify those things that are going to work well across a wider footprint, so that we're not, you know, duplicating activity. I think an important component of that will be developing a sort of COVID-19 surveillance dashboard. As a local authority, we've got a lot of experience of pulling different data sets together. We've done that really effectively to support vulnerable people as part of the community hub. We've also done it really effectively as part of the shielding work. And we're also doing it as part of the recovery planning as well. So that will be a really important component of the plan. I think there's been a lot of talk about the reproduction number and concerns about the impact of multiple relaxation measures, and are we going too quickly? But I think, you know, the key to preventing a second wave is basically for all of us to stick to the rules. And as part of the COVID, as part of the local authority control plan, there's a requirement to set out an outbreak engagement board. Veronica, Councillor Jones has agreed to chair that. It does need to be a member-led board, and I think that board will be absolutely critical in ensuring that we get messages out to the public, not just on complying with some of these basic measures around social distancing, hand hygiene, and, you know, minimising our contact with other people, but